Welcome to Dementia Friendly Prince George's County, Maryland, Northern Sector webinar series for caregivers. Today's topic is Having Courageous Conversations by Miriam Redon Ponce, sponsored by Prince George's County Government and the Department of Family Services.
Today, we are going to have a great time talking about how do we have courageous conversations. And I want to start off with a quote of mine that I really enjoy, and it's by actually Franklin D. Roosevelt. And it says, "Courage is not the absence of fear, but rather the assessment that something else is more important than fear." So a quick introduction. Curative care, it can be defined as treatment or therapy that can help resolve an illness rather than simply treating the symptoms, for instance, medication therapy or surgery. Symptom management can help stabilize or treat symptoms, but do not cure the disease. For instance, paracentesis for liver failure or replacement therapy such as dialysis for kidney failure. However, when curative treatment is no longer an option or effective, providers may suggest ending curative care and focusing on comfort care. While this might sound like giving up, the decision is made while keeping the patient's best interest in mind and focusing on a good quality of life for you or for your loved one. When should I have a courageous conversation? Well, when transitioning from curative to comfort care, it is very important to have a conversation with your support system. For example, your family, your friends, coworkers, anyone that you trust, or anyone that should be included in that conversation. And the purpose of having these courageous conversations with your loved ones is to discuss your goals of care. What kind of end of life decisions do you want to make? Who is going to be your power of attorney? Do you have an advance directive? Do you have burial arrangements? Do you have financial planning? For example, if you have assets like a home, do you have a living will? All of these questions can be shared with your loved ones so that we all know what your wishes are. Courageous conversations should be done as soon as you confirm or suspect that the illness has become terminal. It is important to start the conversation as early as possible to prevent doing so in a crisis. For instance, who will be your power of attorney that can make end of life medical decisions if you are no longer able to do so? It does not have to be a family member, but it should be someone that will honor your wishes and that you can trust. A financial power of attorney, they can make final decisions on your behalf and use your finances for your care and more. How to have a courageous conversation? Well, decide who do you want to include. Make sure to allot enough time to ensure privacy, minimize distractions, and make sure you have enough time to get everything that you need to say out. You also may want to start by saying, I would like to talk to you about where I am with my health and what my plans are for the future or what my wishes are. You can approach the end of life part of the conversation by saying, I wish that I had better news, but, or you can say, but this is what I want for myself because I want to focus on comfort care or I want to focus on my quality of life. During the conversation, it is okay to have some silent moments. Allow everyone to understand the process and the information that is being given. You can reassure your loved ones by saying, with comfort care, I am hoping to manage my symptoms, for example, my pain, nausea, seizures, or any other symptom. Or I want to maximize my quality of life from day to day and have memorable moments with you all. You do not have to discuss everything at once. You can decide who your power of attorney will be, your financials, or other arrangements at another time. What about talking to children about end of life? Well, some adults, they avoid talking to children about end of life. However, kids can sense that something is wrong. They notice the changes, and they pick up on the moods. Talking openly with the child can prevent loneliness, helplessness, guilt, or feeling left out. The child will also need help to understand what is happening and emotional support to deal with the situation. Allow for the child to express their fears, their thoughts, ask them questions, they can ask questions, and they can express their feelings. Seek professional help from the schools, the county, or other professional services. What is end of life care? Hospice care is available for anyone who has been given a life expectancy of 6 months or less. Hospice care can provide a comprehensive symptom management and provide support to the patient and the family or caregiver. Hospice care can focus on the physical, emotional, and spiritual needs of the person. For instance, psychosocial concerns, resources, questions regarding what to expect at the end of life, or anything else that you may need. Hospice can also be done anywhere the patient lives, for example, in the home setting, assisted livings, group homes, nursing homes, etc. Hospice can also provide respite care to help the caregivers with burnout or in case of emergencies. We have inpatient centers that are available for patients who have unmanageable symptoms in the home setting, with the hope that once the patient is stable, they can return home. End of life continue. Hospice care professionals can explain end of life decisions such as what is a full code, for example, CPR, or do not resuscitate, do not intubate, which is called a MOST form. It is different from an advance directive, all while keeping the patient's quality of life in mind and the goal to provide a dignified death. Hospice goals is to support the patient during his or her final days. Hospice care has an interdisciplinary team which consists of a nurse, a social worker, a home health aide, a chaplain, a hospice doctor, and volunteers. Everyone's goal is to support the patient and family or caregiver. Hospice provides bereavement services after the patient passes and pre-bereavement services if we are struggling with what's happening before the patient passes. We also provide honor salutes for our veterans. Where do we provide service? Well, Hospice of the Chesapeake provides services in Anne Arundel, Calvert County, Prince George's, and Charles County. And you can find more information on the website. You can call me, you can email me as well, and I will be more than happy to help you.